Hi, Dr. Gan from Dr. Vein Medical Clinic. Today I'm going to be talking about pregnancy and varicose veins. Now, patients that are currently pregnant or are even planning to get pregnant or in the process, it can be quite challenging when you develop veins in your lower limbs because you go from one day having nice smooth legs to another day where all these changes of pregnancy is happening, and it can be quite overwhelming. And what's worse is as the pregnancy actually progresses, these symptoms can actually get worse, and this includes pain, aching, even a swelling or heaviness in the legs. And this is because the uterus or the womb gets bigger, putting a lot of pressure on vessels in your tummy. This prevents blood from actually returning back into your heart, and therefore you get a lot of blood actually stagnating in your legs, causing these veins that were usually quite small to start bulging and popping out in your legs. A lot of patients can deal with the signs such as the varicose veins, but they can't deal with the symptoms, which can be quite annoying. Now, during pregnancy as well, you get a lot of hormonal changes, and this is due to progesterone predominantly, but can be also due to estrogen, causing a lot of these valve changes in your veins and also distension. What I generally tell patients, especially if you're pregnant, is unfortunately you can't have treatment now. You have to sort of wait till you have the delivery, and oftentimes wait till you're done with breastfeeding if that's something you're going to go down. But more importantly is if you're pregnant and you're developing symptoms, the options are you can wear medical grade compression stockings that basically avoid that distension of your veins and keep your legs nice and tight. This is something we can help you with at our clinic, especially if you're going through that period where you're in that gray area where you're pregnant and you can't get treated at this time. The other thing you can do is actually elevate your legs above your heart as much as possible. I know with a pregnant child, the last thing you want to do is lifting your legs and putting it against a wall, but if you can lift it and put it on an area sort of a little bit higher that is comfortable enough for you, this allows draining of blood back into your heart. Now, there's a myth or a little saying that goes around that a lot of patients come to me and say, I've been told that I should get my veins treated once I've completed the number of children that I want to have, so completed all my pregnancies. Now, this is a bit of a misnomer, and the reason for this is because if you wait till you complete your pregnancy, oftentimes you're going to struggle quite a bit with symptoms during the pregnancy with your varicose veins, and also you're going to have quite a lot to treat if you wait long enough. And I often tell patients that if you have a lot to treat, it's going to be a lot more costly for you, as well as it's going to be quite a bit of treatment to be done at the end of it. So cosmetically it may cause a lot more symptoms and signs, or more signs than symptoms at the end of it if you do wait. So I tend to tell patients, get them treated in between pregnancies if you're planning pregnancies, but obviously if it's unplanned, that's something that you can't expect, but it's something that you can look into. The other thing is you can't get treated during pregnancy, during delivery times, and oftentimes within the first 3 to 6 months. So you do have to actually wait, because that's a time where you may consider breastfeeding or you may not, but also the opportunity for your body to go back to normal and hoping the veins will actually regress is usually during the first 3 to 6 months. So we actually give your body that chance to get back to what was normal or what could be a reduction in these veins. Now, I hope I've sort of made this clear in terms of the conservative options if you were pregnant, as well as some of the reasons why you get these varicose veins and when you optimally really want to get them treated.